Hi, everyone. We got Dr. Harry Adelson. He is an amazing stem cell specialist who is now in the midst of a pretty fascinating legal battle in the career path you've chosen.
Mm-hmm.
Tell everyone who doesn't know what's going on, what just happened to Dr. Kristen Camella as well as to US Stem Cell?
Well, so Kristen Camella was one of the people who pioneered the use of adipose-derived stem cells. So we have stem cells in every tissue in our body, and their job is to maintain the health of their microenvironment. And when we use them therapeutically, one of the things we can do is take them from one part of your body and move them to another part where you are experiencing degeneration. And the two main body parts where it's relatively easy to harvest bone marrow and then deliver them therapeutically are the bone marrow or the fat. Well, bone marrow has been used for many years. It's been used for cancer treatments, and it's just considered an off-label use. If you take stem cells from fat, because they're so tightly adhered to the fat cells, you have to put them through a process in order to separate them from the stem cells, in order to separate the stem cells from the adipocytes. And Kristen Camella was one of the people who really pioneered this method of taking collagenase, which is an enzyme, and enzymatically digesting the fat. So you do a small lipoaspiration. This is like a miniature liposuction, and then you put the fat in collagenase and you incubate it for a short period of time, and then you centrifuge it. Very simple process, very, very safe. Between the Cell Surgical Network and myself and Kristen Camella and all these other groups, there have been tens of thousands of treatments with no problems at all. Well, the FDA has decided that because you take these cells and you add this enzyme, this harmless enzyme, that this is what they are saying is more than minimal manipulation, and is thereby your own stem cells are now a drug. And the doctor, in this case Kristen Camella, is a drug manufacturer, which to me to most logical, reasonable people just seems crazy. But they get to make the rules. So I'm myself am preparing to phase out using fat-derived stem cells, which breaks my heart because I've helped literally thousands and thousands of people with this, and I'm probably going to quit doing it.
It's heartbreaking. It's almost like we're pushing our nation behind, because guess what, people? All the other nations out there are making huge leaps and strides.
Forward, not backward. Forward.
Talk a little bit about the successes you've seen, because again, I went through the process with Dr. Kristen, so I've had my own experience, but talk a little bit about who have you been helping so far and what results have you seen?
Sure. So I've been doing stem cells. Well, I've been doing regenerative medicine for 20 years. I started out doing Prolotherapy, which is the injection of natural substances into damaged musculoskeletal structures. So the idea is you have low back pain, you have neck pain, you have arthritis, you have an area of your body that has undergone some sort of degeneration, whether it's from an acute injury or whether it's from wear and tear over a period of years. And the microscopic anatomy of that area becomes irregular. The collagen fibers that normally stretch just the right amount in every direction stretch too much in some directions and not enough in others. And more importantly, the nerve fibers that pass through those collagen fibers are getting caught up and firing pain signals. The other thing that happens when you have these changes in the microscopic circulation is you get changes in the microvasculature, the microscopic blood vessels that are responsible for bringing nutrients to the area and metabolic waste away. Well, when you have areas of degeneration, these blood vessels become irregularly shaped and lose the ability to bring nutrients to the area and metabolic waste away. So when we take stem cells from one part of your body and bring, or early on, we're talking about regenerative injection therapy. When we inject natural substances, trick the body into thinking that it's been injured, thereby launching a healing cascade. We haven't done any actual damage. You get a second chance at healing without actually doing any damage. So you're just basically harnessing the body's natural healing response.
It's brilliant.
Well, then platelet-rich plasma came along, and that's just doing a blood draw, concentrate down the platelets from your blood, and the platelets are what are those are what signal to your own stem cells to go into action. It tells you that there's been an injury. So so we started using platelet-rich plasma instead of like dextrose, which is what we used before for prolotherapy. And then in 2010, I had a patient come to me and said, I want you to inject stem cells from my bone marrow into my knee. I was able to help her to a certain point with platelet-rich plasma, but we just couldn't get her there. So that's 2010 is when I started doing bone marrow stem cells. Then in 2013, Kristen came and taught me how to isolate stem cells from fat. And I've always combined. I've always used bone marrow. I've never stopped using bone marrow.
Oh, okay.
Bone marrow is really the workhorse of stem cell medicine. I mean, it's been around the longest. It enjoys the highest number of scientific studies. It has the most scientific evidence behind it. When I add fat-derived stem cells to it, I seem to get better results. And I've done at this point over 6,000 stem cell procedures. We've done over 800 stem cell injections into intervertebral discs, which, I'm very happy to say places me among the most experienced in the world with spine injections. And, and I get asked that a lot. I get asked, well, tell me some of your cases. And there's just so many. I mean, we've just what's really astounding to me is that I've been doing this for coming up on 10 years. And I still am blown away by how well it works. Sometimes I have trouble believing it. I talk to people and, they're a year out and I just have, it's amazing to me. Now, having said that, of course it doesn't work with everybody. Where stem cell therapy really shines is with people who are in good health to begin with.
Okay.
Because we're using cells. And if a person's overall health is largely determined by their stem cell function. When you look at somebody who's 70 years old and they look, 50, it's because they have very robust, healthy stem cells. When you look at somebody who looks much older than they actually are, it's because their stem cell function is suboptimal. When you have people who don't exercise, who have crummy diets, who don't take care of themselves, and maybe genetically they're behind the 8 ball to begin with, we don't do as well with that category of people.
That makes a lot of sense. So with that said, I'm going to still push you on it. What's the one thing of the 6,000 or so people that you've worked on, which is the one that surprised you? I mean, did you make someone who couldn't walk, or inspire us? Tell us something.
Like a really weird story? Okay.
Yeah.
So I had a woman once. So I have to do a little disclaimer. So my practice is musculoskeletal pain. So I treat, back pain, neck pain, joint pain. I don't treat any systemic disease at all. I don't treat spinal cord injury. I don't treat, I'm very selective in what I do. I just keep it to what I'm good at. I had a woman who had been to me, she had been to me 2 years prior, and I treated her knee. She was a young woman. At the time, I think she was about 40, very athletic, very healthy. I had treated her knee. She had a painful knee that we had helped her with. When she came into me, it was for something completely unrelated. She had a herpes infection of her inner ear. She had like a herpes lesion on her inner ear, and it left scar tissue. And so she had this severe vertigo, like young, healthy woman. She had to walk along the wall like this. Like it left a scarring, and it really just permanently damaged her inner ear. And she was just like, all the conventional guys said, look, we have no idea what to do. There's really nothing more to be done for you. Right. And so she came to me and said, look, just put stem cells there. I said, well, I can't really put stem cells in your inner ear, but I said, I can put it kind of close. There's an injection that we do. It's called a sphenopalatine injection. Usually I use it for trigeminal neuralgia. And I said, look, I'll do this, but I really have no idea. I don't think it's going to help. And I just have, I'm happy to do it for you because you're so determined, but like, I don't think it's going to work, but we can do it. And it worked. It cured her vertigo. I was flabbergasted. I could not believe it. So it was the closest I was able to get the stem cells to the area. So anyway, you asked me for the most like shocking, stunning case.
Yeah.
And that's it.
So
but,
now that you can't do adipose-based stem cell, are we still approved to do bone marrow-based? So are you going to continue practicing
as
that?
far as everybody says, as far as anyone can tell in the industry, bone marrow is safe. What I'm sort of doing, what I've started using in the last couple of years, in addition to, so I've built my reputation autologous stem cells. So the word autologous means donor and recipient are the same person. So stem cells from your body. And we, mostly use bone marrow combined with fat. Now we're looking at losing the fat and just using the bone marrow. What I've started using in the last couple of years that I'm very excited about are exosomes. Now, exosomes do not come, your own stem cells produce exosomes, but the supplemental exosomes that I use come from someone else. And so I use a lab that what they do is they take placental stem cells. So these are, a woman is giving a normal, they're actually giving cesarean section births, and they have volunteered to donate their placenta. And this lab takes the stem cells from the placenta and culture expands them. Then now exosomes are, so let's just go back to biology 101. So you remember from biology class, you have the cell membrane, right? And then that's a bilipid layer. And then inside you have the nucleus, which contains the genetic material, and you have the Golgi apparatus, and you have the mitochondria, which of course Dave Asprey loves to go on about the mitochondria. And then you have these vesicles called endosomes, and then inside the endosomes are the exosomes. Now when this cell, when I was in school back in the 90s, we used to think that these endosomes and the exosomes were waste. We thought they were cellular poop. They're not. When the cell needs to communicate with surrounding cells, that endosome moves to the edge of the cell, morphs with the cell membrane, and now opens up this way, and those little exosomes go out. Those exosomes are the communication proteins. That's the way the cells communicate. And with stem cell, when we use stem cells therapeutically, the actual mechanism of action is in the cell's ability to communicate. And those exosomes are where all the mechanism of action occurs. All the benefit, that's the active ingredient. So what this lab does is they take these very young, robust placental stem cells, they prompt them to excrete these exosomes, they collect the exosomes, separate them from the stem cells. So now you're moving the person's genetic material over here, you're just using the active ingredient. We then supplement people's own bone marrow stem cells with these exosomes. Now, what makes I had my birthday yesterday. I turned 51.
Happy birthday.
Thank you. What makes my stem cells 51-year-old stem cells is that as we age, our own stem cells lose the ability to manufacture these very endosomes, exosomes.
Got it.
And that's the active ingredient.
Got it.
But the membrane of the exosomes from these culture expanded placental cells are identical to our own stem cell membranes, and it doesn't contain any genetic material. So what we think happens is that your own stem cells actually absorb them into themselves, thereby making your own stem cell much more robust, effectively a younger person's stem cell. And I've seen that, over the years of doing this, what I found is when I get people over the age of 70, my results are a little more hit or miss. Some people do great, other people don't do as well. Since I've started using the exosomes, I've found that I get much more consistent results, especially in the older population.
That's really encouraging. So I think what I'm hearing you say is we may be losing adipose, but you found an alternative which can supercharge your core procedure. So all is not lost.
Right.
Okay. Because I think as someone on the other side going, well, this was an incredible opportunity. Am I going to have to fly out to a different country every year to try out my stem cells, I've been real concerned, and I'm reassured by you that there's probably some good, exciting alternatives. Now, for those folks out there who don't want to go through a procedure of some sort and want to figure out a way to awaken their stem cells naturally, what are some of the things that you've seen work, or what's the science there?
Well, I think common sense really rules the day here. So, you know, I'm getting ready to give a talk at Young Living Essential Oils, their big conference on CBD oil. And one of the things I'm going to really try to impress on people is you can take all the CBD all day long. If you don't exercise and you're obese and you have a crummy diet and you're you know, have sleep apnea and you are emotionally completely unbalanced, all the CBD in the world isn't going to really do any good. And you know, one of the things that I've seen, especially in people sort of in the alternative realm, is they'll sort of latch on to certain things and think it's going to be cure, you know, sort of compensate for the fundamentals, and nothing replaces the fundamentals.
There's no shortcut, as I tell people. There is no shortcut.
There's no shortcuts. That's exactly right. Sleep, diet, exercise, emotional balance. It's those four things. And, you know, with diet, it's mostly common sense. You know, I love Mark Hyman's new book, Food, What the Heck Should I Eat? Because
I've interviewed him. We have the interview. So for those of you, please check out the book interview. You can get at least a summary chapter by chapter with Mark. Yeah.
Yeah, it's, you know, if you can't pronounce the ingredients, don't eat it. Like, it should have one ingredient, which is that object, right? So I mean, that's the first thing, is just to cut out the crummy stuff. Like get rid of the nitrates, get rid of the high fructose corn syrup, get rid of the toxic oils, get all that stuff completely out of your diet. Focus on whole natural foods. And then as far as, you know, the this much protein, that much carbohydrates, like all of that really is secondary. Like that really, like you can get really insane about that stuff, but it's really like get back to just focusing on ingredients. And then, you know, and I think this whole idea, I read somewhere, you know, stop counting calories and start counting hours per day not eating. You know, when I lived in France, like there's not a lot of obesity in France compared to the US. People don't eat between meals there. You eat 3 meals a day and that's it. There's no snacking. And I encourage my patients to just like stick to your 3 meals, try to have your dinner kind of early, and then have at least 12 hours of, try to be done eating at 7 in the evening and don't eat again until 7 in the morning.
It's actually really simple. We've made it so complex because of the different marketing entities out there that want to market a specific new fad or pill or supplement or whatever you have it. But you captured it so beautifully, right? Eat 3 simple meals, eat what's in season, cook fresh, don't open packets, don't open cans, don't open the freezer. And if you eat that, you don't have to count calories, you don't have to count pretty much anything. You cook what's in season, you eat 3 meals, you eat kind of early, you walk everywhere and think happy thoughts, and you'll be fine. I think the issue because
there's 2 sources of information. There's 2 major sources of information. There's government, you know, sort of entities that are, I'm sorry, but I mean, they're heavily subsidized by the food industry, and there's a lot of conflict of interest there, and I just don't have a lot of confidence in those guidelines. Where people mostly look nowadays for nutritional advice is from the bodybuilders. I mean, those, like the whole paleo, all the keto, like all of that stuff comes from the bodybuilders.
So true.
The thing though is these are bodybuilders, and they're trying to get their fat down to 4%. So they're taking it to such an extreme.
Exactly.
So like you don't need to take it quite to that extreme, right?
Exactly.
So just somewhere in the middle, and that's why I love Mark Hyman, because he's just it's common sense rules today. So that's diet. As far as exercise, you know, there's 2 things to keep in mind. It's better to do something than not do anything, right? So, I mean, I think the most important thing is like find something that you like to do. It has to be something fun for you and something that you will actually do, right? So like on the one hand, it has to be fun. And on the other hand, it has to be something that actually can fit into your schedule and you can actually do. And then beyond that, I don't think it matters so much, with the caveat of the two things you want to avoid are with the weightlifters. I mean, just from my perspective, right? So I treat chronic pain. Like my job is people who are injured and their lives have been ruined. So, I mean, think about, I've heard over 10,000 stories of people like telling me why their quality of life has been destroyed. So I have a little bit of a perspective on some of this stuff, but like people, like weightlifting, I think is the best form of exercise unless you chase numbers. Like that's like, there's no reason to go beyond 2 times your body weight for squatting and deadlifting. You know, the people who are just like so, you know, like just it becomes an obsession for them. Those are the guys who are just like, they paid the down payment for my house. You know, that's like, that's how unfortunately, that's how people.
Yeah.
So that's the first thing, is just to quit chasing numbers, right? The second thing to avoid is repetitive motion on hard surfaces. So I hate to say this to the marathon runners who do marathon on concrete, tennis players on concrete, but just something I've seen over 20 years of clinical practice is it just completely tears down your body. And then I'm going to add one more thing. So the third thing is the weekend warrior syndrome. So something that I see, like some of the worst MRIs that I see are the people who sit at a desk from, you know, Monday through Friday, or even worse, like dentists or truck drivers, people who really sit in one position Monday through Friday, and then Saturday, Sunday, they're in a hockey league and they just bash themselves up. So it's like all this trauma over the weekend, and then during, you know, and then when they're recovering from that, when normally you'd need sort of like normal movement for those collagen fibers to lay down in the correct orientation, they're in one position, so they get this very chaotic collagen matrix. And those are the people who have the worst MRIs, or the weekend warrior syndrome. So, you know, that's exercise. Emotional balance, you know, that's very personal, right? So that's, for some people, that's going to be meditation. For some, I think whatever form that takes, that's very, very individual. And then of course, you know, sleep, and that can be very complex. You know, that can be, in my case, I've got a 1.5-year-old and a 3-year-old. So I'm still like, I don't have any choice but to have poor sleep at this point. But you know, I think sleep, something that people really need to look into is sleep apnea, you know, because that's something that is really rampant. And if you even suspect it, I just encourage people to get tested for that. And that involves going to a sleep lab. And then just having a very clean sleep environment, you know, the concept of sleep hygiene. You know, I think that's one of the real critical things for overall health. So those are my 4 pillars of health.
I love it. So from an exercise standpoint, we know what you don't encourage. What have you found to be the most efficient form of a workout? You mentioned weightlifting as one. What else? You know, how about an elliptical or HIIT training or yoga? Where do you come out on those?
Well, I like HIIT. I think again, it's personal preference. I think it's what people like. I got one of those water rowers, which is, I think it's waterrower.com, but it's a rowing machine that actually has a water element to it. So it's like you're pulling on the cable, and that's spinning a propeller that's in water. So it has this very nice water element to it. I love that thing, and I think it's a really nice movement. You know, because it's really a full body movement, and it's very low impact. So just as far as like a 10-minute, like where you can really get at it, and you can do that with a HIIT, you know, 30 seconds fast, 30 seconds slow. You can, you know, you can get a really, really efficient workout with that.
All right. So I think we've got some incredible information from you on the 4 pillars that you support. Tell us a little bit about, what does your day look like? How does the stem cell expert on pain take care of his own health?
Well, my morning routine is very important. So I try to wake up first. I try to be the first person out of bed so I can have, because as I said, I've got a 1.5-year-old and a 3-year-old. So that's my quiet time. So I do my morning meditation, and I do a little bit of reflection on the day. I do a little bit of journaling. And then I start my day. I have a good, wholesome breakfast. My personal favorite is we do 5-minute soft-boiled eggs. And avocado, and then either we alternate between salmon or we'll occasionally have bacon, nitrate free, of course. And then come to work. I have a very pleasant work environment. Work with a great team of people. I love the people that I work with, and get to do stem cell procedures all day, which is absolutely my passion. And then in the evening, I go home, do a little bit of time on the rowing machine, do a little bit of weightlifting. I have just a squat rack and a bench at home. And then like to go for a bike ride, put the girls in we have a very nice, I live in Park City, so we have great bike rides here. And then get the girls to sleep and have a little bit of alone time with mommy before we go to sleep.
Very nice. Sounds very rejuvenating and very conducive to stem cell growth.
Mm-hmm.
So thank you for sharing that with us. All right, for those out there who are suffering from tremendous pain issues, and as we know that itself is an epidemic, pain, we know what's happening with the opioid crisis out there, and a lot of that's driven by the fact that people are in pain. So what can you recommend to someone who's in a lot of pain? What can they take away from you today?
Well, getting off opioids is the first step. Because the issue, what we've really discovered with opioid medication is it actually makes the problem worse. To use them very short, there's really two situations where they're appropriate. One is short-term use, like after a surgery. The other is for palliative care. If someone's dying of cancer, that's an appropriate time to consider using long-term opioids. For something like low back pain, not only does it, it will help in the earliest stages, in like the first few weeks of taking it. But what it does is it actually reduces your own threshold for pain. So now after you've taken it for several months, it actually makes the problem worse, because if you come off of it, your brain has lost the ability to really process pain properly. I think there's some interesting research being done with CBD, with the endocannabinoid system. Really what the endocannabinoid system is it maintains homeostasis in our bodies. It maintains balance in our bodies. And that might be why it's helpful for people with chronic pain, because it's actually, if someone is living with some type of injury and there's some sort of pain generator, it might be that what it's doing is it's making it your new normal, which it isn't necessarily addressing the problem, but it's taking you off this sort of crazy fluctuation of pain. I think clearly I'm biased because I do stem cell medicine, but for people living with chronic pain, as we said earlier, a lot of chronic pain generators are these changes in the microscopic tissue. And one of the things that we know from the wound care literature is that stem cell medicine improves microscopic anatomy. So when you have a wound that won't heal properly, you put stem cells in the area. The first thing that happens is you grow new blood vessels, then you grow skin over top. And that's what it is we think is happening with stem cell therapy, is you have these changes to the microscopic anatomy, which are causing pain. We put stem cells in the area, and as I said earlier, tricks the body into thinking you've undergone a new injury, launches a healing cascade, and that's been pretty much what I've seen time and again. Especially things that are really, there's no good conventional treatment. So, for example, desiccated disc, dehydrated disc. When people have that midline, that pain right in the middle of their low back, if they bend slightly forward, it makes it way worse. They get an MRI, these levels up here, white, black, and then you see this one disc that's just black. And what that means is it's dehydrated. This is very painful. And the thing about it is there's really no good conventional treatment. The only conventional treatment is fusion. And that's a terrible option. This is one of the main things that I do here at Docere Clinics is we put stem cells directly into that dehydrated disc. And within 6 months, the vast majority of people we treat are, not necessarily 100% pain-free, but experience a dramatic reduction in pain.
Wow, it's real exciting stuff there. By the way, what are your thoughts on, because so far you've talked a lot about injecting stem cells at the point of injury or at the point of pain. What are your thoughts about the general stem cell shot, which you just take it intravenously, it gets into your blood? Any thoughts on that?
That's one of the areas the FDA really hates, because that's treating, now you're treating systemic disease. And I've really just kept my practice laser focused on the treatment of chronic musculoskeletal pain.
Got it.
I think there's tremendous, there's tremendous promise in a lot of different areas. I mean, in the treatment of disease, but even just in anti-aging. There was that one paper by Dr. Hare in South Florida that was, it was treating frailty associated with aging. So that's an actual condition. So, we talk about anti-aging medicine. Well, the way we actually measure, there's a way to measure, it's called frailty associated with aging. And it's a combination of 5 things. There's several different scales, but it has to do with like loss of muscle mass, sleep quality, sexual function, and then there's a couple other things. I memorized it for my last Dave Asprey podcast, but I forgot it. But essentially what he did is he took this group of people, measured their degree of frailty associated with aging, and then gave them intravenous culture expanded stem cells from donors, from bone marrow from young donors, and gave them in either doses of 1 million or 2 million. And pretty much across the board, I mean, it was very compelling. The outcomes were very compelling that it actually reversed frailty associated with aging. So if you're talking about stem cell medicine for anti-aging purposes, yeah, I mean, I think yeah. And the product that we've developed is called the full body stem cell makeover. And that was designed really, originally it was for Dave Asprey because, his goal to live to be 180. So we developed it for him. I've been doing it for a couple of years, and how it came about is that over the years, I've just had so many like ranchers and oil field workers and farmers and just busted up cowboys, these people with arthritis through their entire bodies. And I use anesthesiologists to sedate people. So we put people to sleep. And because of this patient population, I've sort of developed a reputation as a guy who does big treatments. So I'll have people come in and we'll do both shoulders and both elbows and both hips and both knees and their back. So we developed this full body stem cell makeover, which is essentially we take a large volume of bone marrow, we supplement it with a large quantity of exosomes, and then we inject literally every moving part in the body. We do the entire spine from the base of the skull down to the tailbone, flip the person over, both shoulders, both elbows, both wrists, both thumbs, both hips, both knees, both ankles, and great toes. And I came up with the idea because early on, I was treated with rolfing, and which is a full body, it's a system of sort of full body massage, but it's much more than massage. And I thought, well, what if I could just treat the entire body in a single sitting with stem cells? So we've been doing it now for a couple of years, and people have been very, very happy with it, including Dave.
That's right. That's right. He's your price customer there.
Yeah.
So how often does he come back, or how often do you need to come back when you do these full body makeovers?
Well, full body stem cell makeover, we do it once, and then it's not something I would recommend doing regularly.
Okay, got it.
Because it is a big bone marrow aspiration, and I think it's perfectly safe to do that once or twice, but I wouldn't want to do it sort of like every year. I think if someone were to want to do it on an ongoing basis, then we would talk about, there's a clinic I'm talking to in Mexico about possibly doing it there with culture expanded cells. So I would actually, if someone were going to do it more frequently, we probably wouldn't use their own cells, just because I wouldn't feel so good about doing such a big bone marrow aspiration several times.
Got it. And if I understand you correctly, you couldn't achieve the same results by just injecting in the IV, injecting it in the blood.
No, I don't think you would, because really what we're focusing on is the musculoskeletal structures. If you do it IV, they're all going to go in areas where you have very rich blood supply, which are the organs. So like the first place is going to go to your lungs. It's going to get caught up in your lungs. They're going to dump their growth factors, and then it's still going to go to the the most obvious areas of blood flow, like the heart, like the liver, like the organs. Your joints, though, where you have problems in your joints, are areas that are poorly vascularized. There's not good blood flow. So you can't really depend, and especially like if you're talking about intervertebral discs, there's no blood flow in the intervertebral disc. So you're not going to get any benefit in your musculoskeletal system from an IV.
Got it. Got it. That makes a lot of sense. Wow, this has been so enlightening. Thank you so much again. Any parting advice for someone looking at getting stem cell treatment? Is there a deadline by which they can sneak it in? And
well, just do your homework. I mean, and I would really encourage people not to feel a sense of urgency, because you don't want to, it's a decision you don't want to rush. There's a lot of really good providers, and there's a lot of really mediocre providers. And so you really want to look at, does this person, how much experience does this person actually have in the area of regenerative medicine? Do they use guidance? Do they use at least like ultrasound guidance or X-ray guidance, or preferably both? And do they offer some kind of sedation? And you may, the person looking to have this done may or may not need IV sedation. They may not need an anesthesiologist to put them to sleep. But if the center offers sedation, it displays a level of seriousness on the end of that surgical center.
well, on that note, I have to tell everybody out there that we are going to be creating a Heal Circle page which lists this information as well as referrals. So if you're interested, make sure you check out the Heal Circle page for stem cell referrals. And with that said, Dr. Adelson, thank you so much. Really loved having you on the show. And for the rest of you, stay smiling. I'm going to see you on another one of our healthier podcasts.
Thank you.